everyone, and welcome to today's virtual Schwartz Rounds office hours webinar. It's nice to see a couple familiar names. We have a really small group today. Hi, Linda. Hi, Kim. Hi, James Hogg and Andrew Carlson. I don't know you, but it's nice to see you've joined us. This is Stephanie Adler-Yuan. I'm Director of Training and Education for the Schwartz Center. I'm here today with my colleague, Beth Lown, who's our Chief Medical Officer. Want to say hi, Beth?
Hi, everybody.
Hi, everyone. So we know you're all busy. We're so grateful that you've taken this time today. Our plan for today is to walk through some of the basics around our guidance for virtual Schwartz rounds. And then hopefully we'll have a few minutes to open up for conversation. I'm so sorry we got started late today. Before we get started, I just want to take a quick poll to see if you all need to end at 4 p.m. today. So if you're on the line and you wouldn't mind answering my little poll to tell us if you need to end at 4 or if you are okay to go until 4:15, and we will definitely go with, okay, I think we have everybody. Fantastic, thanks. So here's our poll. Share results. Okay, 75% 4:15 is okay, and 25% is gonna have to hop off at 4. So we'll try to end the majority of the presentation by 4, and then we'll hang out, and if we wanna do some more questions afterwards. So we might move a little quickly through the material today to get everything in by 4, but we will follow up with all of you after the session. Your member experience advisor will be reaching out. So one more poll for all of you, if you don't mind. Now is I want to know, or we want to know a little bit about your thoughts on virtual Schwartz rounds. We are curious about whether you have already held virtual Schwartz rounds, you're thinking that you're likely to, you're considering it based on what you hear today, or you think it's probably not a fit for your organization. So if you all wouldn't mind letting us know where you sit on that. All right, anyone else? All right, let's share those results. Okay, this is interesting. So today is big. And we will be happy to provide whatever support we can. As we have emphasized, virtual Schwartz rounds and our work on this so far has really been a learning process, and it's been a really collaborative process with our member community. So it's evolving and really relies on open and frequent communication, and we're here to support you no matter where you sit in this, in your relationship to, and you're thinking about virtual Schwartz rounds so far. Just know that we will be with you to support you through that process throughout. So our goals for today are really just to describe the goals and principles of the virtual Schwartz rounds, help you think about planning for sessions, discuss the facilitation techniques that you'll rely on for VSR, and adapt some of our thinking around Schwartz rounds. I know, Linda, this is new for you, but adapt some of the thinking around Schwartz rounds to the VSR model. And Linda will talk more about this. So there's my poll. We already did that. The first thing that we want to really emphasize is that virtual Schwartz rounds is not really intended to replicate in-person Schwartz rounds, but we do recognize, and I think we've all experienced over the last couple of weeks, that online platforms, online gatherings can provide us with a degree of connection and community engagement that we all really need during this crisis. And to the extent that that is what Schwartz rounds in person is also about, and connecting and identifying with each other's experiences, and feeling less alone in our work is a big part of why we come together in Schwartz rounds. We really do believe that we can achieve some of that and drive toward the compassion that we're trying to foster in our organizations and on our teams on these online platforms. Another thing I just ask you all to keep in mind is that we've created a rather general set of guidance, but we are very cognizant of the fact that depending where you sit in your organization, depending on where your organization sits in relation to the current crisis, depending on what kind of organization you're at, you're going to experience this moment in a different way. Your organizational needs are going to be different. So we want you to know that we know that no single set of guidelines is going to account for every one of your situations perfectly. And that's part of why collaboration is so key here, because you're really the experts on what your needs are right now, what you're seeing right now, what your colleagues need, and we really just want to give you a tool to help to support them. So with that in mind, Virtual Schwartz rounds, our goals are really to support compassion for self and other, which is the same as we try to do in regular Schwartz rounds, to encourage mindful self-care, to share coping strategies, again, something that we look for in standard Schwartz rounds, foster connection and community, and key to virtual Schwartz rounds, and we'll spend some more time on this, is that we want to make sure that as we invite people into these conversations, we're not inviting them to revisit the details of traumatic experiences. So that's something that we're going to keep in mind and we'll come back to in a little while. And this really comes from advice from trauma experts, which gave us, I will say, a good deal of pause as we started to think about, conversations about what many of us are experiencing as an ongoing trauma. But we are very well aware that there is some evidence that single session psychological debriefings can actually cause more harm than good over the long term and increase the risk for acute stress disorder and PTSD. And so we do want to all be very careful and cognizant of that as we enter into these conversations, and make sure that as we frame virtual Schwartz rounds conversations for our colleagues, we encourage them to stay in the here and now and follow some of these some of this guidance. So we've got some tips for you on how to do that. So as you plan for your virtual Schwartz rounds, there are a few logistics, and these map pretty clearly to what we look for in standard Schwartz rounds. One thing that's different about virtual Schwartz rounds is we know that many of our teams, many of our facilitators lead Schwartz round sessions on their own. However, for virtual Schwartz rounds, since we're managing both the technology and the content of these sessions, we really have seen in the sessions that our members have offered so far that having a co-facilitator and sometimes also a chat moderator on hand who can help to manage the technology can be really helpful, can go some way to mitigating the anxiety about bringing these sessions online. So that's something we're going to want to think about, and we'll talk to you more about that. The size of virtual Schwartz rounds, we have seen them vary so widely, and they are really going to vary depending too on the needs of your organization. So what I'll say about that is, I think a starting point is saying, what's the need that you're trying to meet? What are your goals for these sessions? What's your comfort with the technology? What's the availability of facilitators? Because if you have more facilitators, you might be able to offer more small sessions. But, and then also, are you really looking for everyone to have a chance to say their piece? Or is it going to be adequate, sufficient for the group to witness each other, to hear from a few voices, and yet come together in community in that way? And I think we've seen that. I think, Beth, do you want to say something about the rounds that you observed this afternoon in that regard?
Yeah, just that it seems as though the larger the rounds are, the harder it really is to engage a lot of different people. And I'll talk a little bit about that in a bit. So you just have to be mindful, and if you, they seem to be taking different formats, the ones that I have observed. So if you have the luxury of doing multiple smaller sessions, terrific. And we have some tips for that. And if you're going to have these very large rounds, I think we're starting to think of some ways to think about that a bit differently as well.
All right, so we'll talk some more about that. And time, again, this is going to vary depending on the needs of your organization, your availability, but I would say longer than 60 minutes is probably going to be a strain for folks on these online platforms, and shorter than 30 isn't going to give you a chance to get into any kind of meaningful conversation for the most part. So we're typically going to be targeting, I would say, 30 to 60 minutes. I think most of the sessions that I've heard of or seen have been 45 to 60 at this point. Topics are really key to virtual Schwartz rounds, and one of the reasons is that we don't have panelists on virtual Schwartz rounds because the goal is really to foster a community-wide conversation. There are some exceptions here, and if you have a planned Schwartz round session that you're transitioning to an online platform, you might end up having a couple panelists because you set that up and it's still relevant. So there are some exceptions there. However, for the most part, I think the goal is to identify a theme around which you want to structure the conversation and around which you can engage participants in a rather structured and detailed and targeted way. One of the challenges I've seen facilitators face is that you're entering into this space, you're not necessarily seeing everyone. Folks who are on their phones might not be on video, and you might not know who you're talking to. And so opening it up to folks just to say, where are you today? What, who wants to share your experience, or who wants to share an experience, hasn't been really fruitful. So having a targeted discussion prompt around one of the themes we've identified here, which you'll note, I'll take a slightly sort of positivist tone, is I think the way we want to open up these conversations. So Beth, would you want to add anything to that?
No, I would say we're not doing cases, or many of us are trying to stay away from cases. Again, I think because those can be so emotionally difficult, and we really don't want people, as we say, sort of debriefing or deconstructing experiences of trauma, because that can re-traumatize people. So we're sticking with these themes, but in truth, it really helps to have two people as sort of ersatz panelists, one or two people to start the conversation around the theme. And if you can and they have time to prepare those folks in advance, it's helpful, because you really do want to coach them to start with more of a positive tone.
Yeah, absolutely. Thank you. And then finally, we get to technology considerations. I have to say, we've been reaching out to everyone who's been on these office hours webinars, which has been around 100 of our members so far, give or take. And most of the anxiety we've heard and the reluctance sometimes to hold virtual short rounds has come from anxiety around technology, which we have varying levels of comfort and familiarity with, right? The first thing I'll say is that if you do have the opportunity, we encourage you to partner or reach out to your IT folks, so that you have that technical support for these sessions, at least in setting them up. And then if you consider yourself to be one of our more Luddite analog types, you might want to also make sure you have IT support on the actual sessions. Beyond that, some technology considerations. Obviously, we want to be explicit in advising our participants too how to engage on these platforms. So suggesting that folks join from a quiet location, either automatically muting all participants, as we've done today, although I promise to unmute you in a little while, automatically muting folks. One thing we've seen is that encouraging people to be on video if they are able can foster a sense of community and familiarity, which is really nice, and can foster conversation. If you do have a very large group, I don't think I've seen anyone do this yet, but I've participated in other online gatherings, and using breakout groups can be a really nice way to enable smaller conversations during a very large online gathering. So if that's something that you might be comfortable with, I'd be happy to talk to you more about that. I know it works particularly well in Zoom. And the other thing we've seen is that the chat function can really actually enhance people's ability to participate. And so folks who might not be willing or able to speak up on a virtual Schwartz round session, you might want to invite them to use chat to share their comments, either on their own experiences, on what other participants have said, to provide supportive remarks. And that can be a really nice way to broaden the conversation. Again, having a co-facilitator or a chat moderator who can read those comments, who can speak on behalf of those participants, who can sort of moderate what's coming in on the chat, can allow you to focus more on the conversation at hand as the facilitator. And then some safety considerations. So we know that safety is so important to the success of our Schwartz round sessions. And we also know that online platforms are not as well suited as in-person gatherings to providing support for significant emotional distress. And so if you are not a behavioral health person or a pastoral care person, we do encourage you to partner with a colleague who has that orientation, who has those skills, who can provide additional guidance and support, and potentially follow up with participants who do need more support. The other opportunity with virtual Schwartz rounds is to share additional support resources that might be available to staff, whether those are your regular typical EAP resources, or whether there are additional resources that are being made available right now around food or housing or what have you, testing, in the context of COVID-19. The other thing, going back to our standard Schwartz round safety guidelines, is that we want to acknowledge that it really is impossible to ensure confidentiality on virtual meeting platforms. We ask that people don't record these sessions. You may ask your participants not to record, or I think there are usually settings where you can prevent people from recording sessions, but you still can't guarantee that people aren't going to take a photograph or record on a phone something that's happening on their computer. So you just want to acknowledge the limits of confidentiality on the online platform, and also reiterate the standard guidelines, what's said here stays here, et cetera, that we offer at Schwartz Rounds. And with that, I'm gonna hand it to Beth, but before I do want to invite you all to enter any questions you have in the questions or chat pane on your control panel for GoToWebinar, and we'll definitely keep an eye on that. And then once Beth talks through facilitation, hopefully we'll have a few minutes to hear from all of you what you're thinking and to invite any additional questions. So Beth, it's all you. I'll move your slides, so just let me know.
Yeah, go ahead. So which forward. Thank you. So I know that you realize this, but what we're seeing is there are so many ways that stressful events can reach traumatic proportions for individuals and for communities. People may experience themselves or observe a lot of pain and suffering. And of course, we're seeing loss of resources or inadequate resources. There's threatened or actual loss of contact with the people we love, people we're close to. There's the loss of a sense of safety, particularly with lack of adequate PPE and so forth. And then, of course, I think it's just a challenge to all of your sense of, what life is all about, what it's like. So we're sort of seeing some shattering of assumptions about what life is and what to expect. And I think also in many cases, as we become increasingly aware that the pandemic is disproportionately affecting communities of color and socioeconomic strata, we have a sense that there's injustice. We feel the sense that there's not equitable healthcare that we ourselves can offer. So it's really challenging right now, and people respond differently. So it's really important to reinforce the message that these are normal reactions to abnormal circumstances, whatever we are feeling and experiencing. Our emotions, our feelings, our thoughts are all valid. But across the board, mental health and trauma experts have identified 5 common themes across what people really need to recover from stress and adversity. And these are represented here. They are a sense of safety or the ability to perceive yourself as being safe, the ability to calm yourself, a sense of connection, excuse me, self-efficacy, which is the belief that what you're doing will actually get you to your goals, and hope. So we've included some thoughts about how these essential 5 elements might inform your virtual Schwartz rounds and prompt reflection and discussion on these various issues. Okay, Steph, can you move forward? So a sense of safety first. Many people really are not feeling safe. They're feeling anxious, they're worried, they're concerned. And I think what we've heard, and I wonder if you've experienced this as well, I think people are concerned about contracting the virus themselves, but far more worried about exposing other people to the virus, of themselves or their bodies actually being vehicles of contagion. People are very worried about this. And so in terms of trying to facilitate virtual Schwartz rounds, what we've tried to do, and you'll see these in the next several slides, is provide you with ways of embedding these 5 essential elements into the very structure of your Schwartz rounds. So you can tell people, why don't you think about out loud, what is helping you feel safe? We may not be feeling safe right now. So encourage them to reflect that whatever their circumstances are right now, there might be something that can ensure their sense of safety. Many people will just bring individuals who are fearful or feeling like they're being exposed or vulnerable, just grounded in the present moment. Right this minute, you are okay. Your mind is functioning. Your body is sound. Take a deep breath. You can feel your feet on the ground. You're okay right this very minute. Those are some types of statements you can make, but I think in terms of the rounds, despite your circumstances, what helps you feel safe? So that's one prompt around that central issue. Steph, go to the next, please. Calming. Again, people are feeling anxious, they're feeling worried, they're feeling stressed. Many people are just, putting their head down and getting their jobs done, and thank goodness for that. But in these sort of secluded moments, they may not be feeling so, determined and purposeful, and they may start to feel their inner sense of anxiety build. And so it's helpful if you hear during a virtual Schwartz rounds that sound catastrophic, worst case scenario, black or white. It's helpful to reground people and reframe them. So, for example, reframing things like, everything is disastrous, nothing will ever be the same. Things like, well, losing everything that's familiar and comforting can be a challenge, but I'm wondering, what can we learn from this experience? What can we learn about ourselves? What can we learn about how we work with each other? And what helps you feel calm? Okay, Steph, can you go to the next? A sense of connection is critical as well. And so social distancing, it really should be physical distancing, does not mean social isolation. We can and we are together. We're together in the workplace, and you can find ways, of course, through technology, thank goodness for that right now, to be together with loved ones. So again, asking people, what are you doing to stay connected? How do you feel connected with your colleagues? And I think if you do ask that latter question, you will start to hear about a sense of common purpose. People are very, very, very driven, and whatever they're feeling about their organizations, they personally are feeling, I think, and I hate to generalize in this way, and perhaps it's not true for everybody. I think a lot of people are feeling quite committed to the work. Okay, Steph. Self-efficacy, again, sort of it's kind of like self-confidence, but it's hard because people are being assigned to do new roles. Essentially, I know in my hospital, we're having evening sessions just about every night, buffing up on ICU skills, critical care skills. Everybody's really being repurposed, redeployed, doing different kinds of tasks. This can be very, very anxiety producing. So telling people that, there are ways that you can get help if you're not feeling confident in your new role. The trainings that we're having may be helpful, but, who can you turn to? Is there a supervisor? Is there a mentor? Is there someone you can turn to for advice? And again, what's helped you gain confidence in the tasks that you're performing now? So again, more prompts for you to consider. That's okay, Steph, keep going. And then hope. I think many of us are used to having conversations with patients and with families about finding hope, even in dark days and difficult circumstances, even at end of life. So we are familiar with these kinds of conversations, and we may need to actually apply these to help our colleagues during virtual Schwartz rounds. So there's always something to be hopeful for. And it's lovely to ask these kinds of questions and to hear what is sustaining people. It does help people also. This is a time when I think people are really asking themselves, what's most important to me right now? What is sustaining to me? And this, I think, actually helps set the grounds for post-traumatic growth, which involves in part finding new purpose or a new sense of renewed purpose. Okay, Steph. So let me I introduce this narrative flow of virtual Schwartz rounds, and we'll go through this a bit more. Okay. Next, thanks, Steph. So this is really a model that applies to regular Schwartz rounds, standard Schwartz rounds. We start by setting the tone, opening up the discussion, building the discussion, deepening it, offering support, and finding a way to bring people back to the present moment, back to their work, so that we can close with people feeling restored, refreshed, renewed. Okay, Steph, next. In terms of setting the tone, of course, just as you would with standard Schwartz rounds, you'd welcome everybody, you'd acknowledge what's going on, that we're in the midst of a pandemic, and express gratitude and appreciation for what everybody is doing. I think it's very, very helpful to offer something at the beginning, whether that's a few meaningful quotes, a brief poem, something to take them out of the rush of the day and into the room together, even though it's a virtual room. Very important. You'll explain the ground rules, the guidelines, as usual, as Steph mentioned, really paying attention to confidentiality. And to the general purpose of Schwartz rounds, which is really to offer a place to listen, to offer to receive support, to offer your empathy, your compassion, and to always, always demonstrate mutual respect. You're really focusing on creating a shared experience of support. There will be, I'm sure, times when systemic issues, organizational issues come up. Not everybody is happy with how their organizations are dealing with the pandemic. They may not feel adequately supported, whatever. Some are. But again, if these issues come up, just remind people that this is a time for collective restoration. It's not a time for problem solving or addressing the systemic challenges that are upon us. Okay, Steph. You'll begin after that tone, by the way, really that sets up the whole culture, the whole milieu, the whole feeling space of Schwartz rounds. It's a place to open our hearts. Opening the discussion, you will then start to explain whatever the theme is, and hopefully you've invited some folks to begin the session, participants, panelists, whatever we want to call them. And if you've had time to just even share a couple of emails to explain the purpose and what you're trying to do, what you hope to accomplish by offering this shared experience, then you can introduce them and ask them to share a story or something related to the theme, some reflections. And then you can invite participants who are in the virtual room to respond, with very, very open-ended questions. What struck you as you were listening? What resonates? What are you thinking? What are you feeling right now? And this can be, I have to say, this can be a challenge in virtual Schwartz rounds to get people to begin to speak. Usually, I follow the 3-second rule at least. Wait as long as you feel comfortable waiting. And then it's difficult if there's a very, very large room of people. I was just on a virtual Schwartz rounds with literally 250 people signed on to a Zoom session. And what I've noticed in those large sessions is that it winds up being more of a sort of an interview between the panelists and one or two facilitators. Today, in this particular session, it worked beautifully. People were just gripped because the two people speaking were talking about their experiences in a very, very important and meaningful way that they deeply wanted to share. But if you have a smaller room and there's comfort in the room, and perhaps you've even had a chance to ask some people in advance if it would be okay to invite them to speak, that can be a way of bridging the silence that can sometimes occur in a virtual rounds. Can occur in the standard rounds too, but I think it's easier when you have that nonverbal language. You can be scanning the audience and so forth. It's easier to get the conversation going than it might be in virtual. Okay, Steph. Once the conversation gets going, hopefully you'll be able to reflect on what you're hearing from people. And again, it's helpful to acknowledge that everybody is sharing the experience, but everybody copes and responds in different ways. We're all unique. even though we're sharing this common experience. So you can reflect back what you're hearing, even if it's from the chat pane. And again, it's great to have a chat moderator if you have that luxury. And if you're hearing very, very strong expressions of emotions, again, it's you don't want to deny them. You have to validate them, that this is how people are experiencing things. But you may choose to reflect what you're hearing in a slightly dampened down way. I can hear the expressions of concern, of anxiety, even of fear, and I'm wondering, what's been helpful for you to moderate these feelings? How are you coping with these? Okay, Steph, go ahead. Deepening the discussion in standard Schwartz rounds really involves pulling out multiple different perspectives and actually looking for differences in perspective so that you can invite people to learn from these differences. It really creates a sense of mutual respect and common learning. To emphasize that you can learn from disagreement. In virtual Schwartz rounds, I think it might be difficult to elicit that kind of thing. And you'll have to just wait and see if people feel comfortable enough with each other to do so. But if you do start hearing these differences, then it's helpful to weight them each with equal respect. On the one hand, I'm hearing this. On the other hand, I'm hearing that. What are you all thinking about in terms of this? And then again, you don't have to resolve any differences in perspective. The idea is to get them out into the open so that they're all available to view, to hear, to think about. And again, if I think we're probably going to see this much more in standard rounds and in virtual, but if there's really strong differences of opinion, conflict in the room, you can ask people, well, have you been in a situation where these kinds of things were resolved with positive intent? Okay, Steph. And then, of course, as you start to think about concluding the experience at about 5 to 10 minutes before whatever time is up, then you might want to ask people to talk about, again, how are they finding support? Where are they finding solace? Who do they turn to for themselves, whether at home or in the workplace? What has helped them? How have they been supported? How have they supported others? So you really want to be sure that you're ending on this tone of mutual support for the community. Okay, Steph. And that will lead you to be able to close with comfort so that people will feel that they've been heard, that their emotions have been validated, that they're not alone, that they're sharing a common experience, which is something we've never experienced before, but they're not alone. They may be responding in their own unique way, but they are not alone. So you can summarize the key themes, thank everybody. If you have a closing ritual that you use in standard rounds, use it here so that people have a sense of continuity. And again, you can consider whether you want to offer some kind of a closing poem or a meditation. Always, always, always have available the reference to support resources. All organizations are offering these pages or EAP or HR or online supports and programs, as far as I can tell. Make sure you reinforce that. And then if there's going to be another round, you can let them know when. Okay, Steph. Sometimes people will really get fixated on some of the systemic and organizational flaws, the things that are there, and with good reason, they're so deeply troubling. However, again, this is not where you're going to resolve that. And so people are bringing up systemic issues. There's not enough equipment. We don't have enough staffing. We don't have enough resources, whatever the issues may be. Just acknowledge them. They're valid. They're important. And yet this is not the time and place. Let's use this time and place to feel a sense of community and to help support each other. We can set that aside for others to resolve later. Okay, Steph. Debriefing, go ahead. This is very, very helpful and important, I think, to debrief with either your planning committee or your co-facilitators. Very important to know, how do you think this went? What were you noticing in the chat pane? How are people seeming to respond to this? And gather all the intelligence you can. It's just critical in terms of informing your next virtual Schwartz rounds, what people appreciated, what they didn't. Sometimes things that you think were a flaw actually turn out to be incredibly helpful. I know I've seen that myself in some of the rounds, the virtual Schwartz rounds that I've done. And especially, even though the participation is just not going to be the same, is my guess, that doesn't mean that people are not benefiting from them. People are listening. And I think we have to just gather as much data as we can. Also, please, you can add a survey at the end if you like, but do send us your reflections and your comments so that we can continuously improve our recommendations around virtual Schwartz rounds. And we need it to be informed by you. You are the ones who are really the implementers and our key informants really about the whole program. And we need to hear from you so that we can make sure this is the best possible program it can be given the current circumstances. Okay, Steph. So here's some of we have a lot of resources. If you haven't checked out our COVID-19 resource page, please do. We have some excellent resources posted there from all different kinds of sources. From the National Center for PTSD, for the Center for the Study of Traumatic Stress, from all kinds of different organizations that are really experts in this material and how to manage it on all different levels. Also, if you haven't had a chance to tune into some of our Compassion Action webinars, you might want to check those out as well. They're all on that same page. They're archived, they're recorded if you haven't been able to listen. And they've been very, very helpful. We've had tremendous positive feedback about those. And then, of course, you'll see on the WebEx platform, the GoToWebinar platform here, Steph has posted the guidance document that we put up. And we'll be changing this as we learn more from you all. So please do help us by sending us your thoughts. Okay, Steph.
Yeah, I just want to also reinforce that your member experience advisor will be reaching out in the next week to touch base on your feedback from this, your thoughts about it, what you're seeing at your own organization. If you have time to talk to us, if you don't, we understand that as well. But do know that we're here to provide whatever support you need and to share with you what we're learning all the time from the broader membership community. So with that, I would love, since we have a fairly small group, not to put everyone on the spot, but I would love to unmute you, if that's okay, and invite some conversation. I'm not sure who it was that needs to leave at 4. Do you want to try to raise your hand if you know how to raise your hand? Person who needs to leave at 4. Andrew, can I try to unmute you? I don't think you're unmutable, strangely enough. You don't seem to be unmutable. So
that's weird.
But Andrew, if you do have any questions or any thoughts, we'd love to see them. If you could type them into the chat pane, that would be awesome. Thank you for trying and raising your hand. Oh, I might have you on audio. Hold on. Let's see if we can unmute you. Unfortunately, Zoom is better at the conversation thing.
Yeah. Oh, I think it's because maybe he called in on a phone rather than through the computer.
Yeah. Oh, he wrote to us. Thank you. No questions. He wrote to us. No questions.
That's what I thought. Yeah.
Okay. So I hope you were able to see this. Well, thank you for joining us, and we'll definitely follow up to see if anything has come up for you. James, can I unmute you and ask if you have any questions? I think, are you in
Yes, I am. Can you hear me?
Yeah.
Oh, wonderful. Yes, I'm at Memorial Hermann. I just very much appreciated this. This was very helpful, and it's really hard to communicate my appreciation to you and to all of the Schwartz Center for helping us navigate all of this. I really don't have any questions, just a lot of appreciation.
Thank you. Thank you.
Well, thank you for taking the time. If anything emerges, think about this program and other work that you're doing there. We've really treasured our relationship with your organization, so please definitely circle back and let us know how we can help.
Well, I sure will, and I'm pretty sure we're going to be doing the virtual Schwartz. The people have been really almost begging for it, so I think it's really time for us to address it.
Great. You know, one of the paradoxes that we've seen is that the virtual platform in some cases has really allowed more people to participate in the programs, even though they're not our typical programs. We've been able to sort of extend our reach within some of our organizations, which is fantastic because that's what we really want is to help people when and where they need it, right?
Yeah, absolutely. One of my, I don't want to say fears, but one of my maybe small concerns is, you know, I don't want to diminish our live Schwartz because that is such a powerful event, and so I think the virtual Schwartz will be really helpful. I'm just not sure what to do once we can go live again. I'm not sure I want to offer both because the live event is just so powerful. Anyway, just some thoughts.
No, we agree too, and we'll definitely be there with you to help navigate that dynamic. I think one of the things that I've seen many of the facilitators sort of open virtual Schwartz rounds with, as we did here today, is some degree of, I don't know if it's humility or an acknowledgement of that very fact. Just, you know, saying that this really isn't a replacement, it's a different thing, it's a complement, it's a substitute. Yeah. And that we will resume when we have the opportunity to be together. I think there will be quite an appetite for that when the time comes.
Yeah, I think so too.
Yeah. Well, thank you for all you're doing, and I know Kathy will be in touch.
Sounds great. I appreciate all of you.
Of course. Thank you. Before I move on to Kim and Linda, I do see one question from Andrew at SSM. I'll read it, Beth. One thing that I'm wondering about, and this might not be answerable right now, is that my hospital, St. Mary's, is the only hospital in our system running live rounds so far, and the rest of the SSM will be having their first intro with the virtual Schwartz round. So I'm curious to see how this dynamic plays out. Absolutely, Andrew. We're curious as well. You're not alone in that. There are a number of members who are joining now and who maybe just joined but hadn't had a chance to start their Schwartz rounds. Linda from Albany Medical Center is one of those on the line. So we, you know, we've adjusted our training to accommodate for that journey, and they are indeed uncharted waters. You're right about that, but we're all in it together, and we'll do our best to find a way through. So with that, I think I will open it up to Linda. Are you there? Can I unmute you?
I am here. Can you hear me?
We can. Yeah. How are you?
I'm good. I'm good. Thank you. Yes. So not really a question, but just a comment. Of course, during this unprecedented time of the pandemic, would be a perfect time to do the virtual Schwartz rounds. It's just because Albany Medical Center is new to the Schwartz Center and to Schwartz rounds, I need a little bit more of a get up and go, because I want to make sure that what I can provide is appropriate and will be very helpful to those that do attend the virtual rounds.
Yeah, absolutely.
And also it's getting the team together too, because, you know, our some members of the team are just, you know, they are not even knee deep. It's like they're chest deep into caring for the COVID patients. So that's another consideration, but I'm hoping that we can work something out so we can just get started.
Yeah, absolutely. So we should circle back because I know we talked about getting everyone together for a training, and I see that that's stalled a bit. So I've been working with a couple of my colleagues here to figure out what that can look like, because it's a reality for so many of our organizations. So let's talk that through and think about what we can do together, and maybe we can bring the entire team in at a later date.
Okay, that would work fine.
All right, thank you so much.
No, thank you so much.
Yeah, so I'll touch base early next week and we can figure out next steps.
Okay, that sounds like a plan. Thanks.
Awesome, thank you. And last but certainly not least, Miss Browning, how are you doing over there in Kentucky?
Oh, can you hear me?
Yeah.
Yeah, we're doing pretty well. I mean, so far so good in Kentucky. We have a fantastic governor who really just like took action really early, and so far our number of cases is very low.
Yeah.
And hopefully that will continue, but you know that's yet to be seen. But you know, we do have a hospital that, well, many hospitals in the state that are definitely gearing up for a potential surge in patients.
Yeah.
And at UK Healthcare, you know, we definitely wanted to continue Schwartz rounds. We have 2 virtual Schwartz round sessions scheduled next week, one on Monday and one on Friday. We decided to offer 2 shorter sessions in the same week just because, you know, schedules are so different right now. And we'll just kind of see, you know, who's able to attend. For us right now, it's just our regular Schwartz rounds are really well attended. And I think very much a part of the whole organization after, well, it's been 6, 7, 8 years for Kentucky Children, 7 years for Chandler, and 6 years for Good Sam.
Yeah.
So they've been part of the organizations for a good bit of time now. When I sent out the announcement for the virtual Schwartz rounds this past Tuesday, it was picked up in our hospital leadership is putting out a daily COVID-19 update email each day.
Right.
And it was picked up in that day's update email, which really, I'm not sure who decided it should be part of that email, but that, like, those of us who work on Schwartz rounds really smiled to see that, because that indicated to us how valued it was by our leadership.
Good.
Yeah, so
That's great.
yeah, so I think most of our questions have to do with, you know, how it's going to work in an online format. And we have 2 different, we have our facilitator from Kentucky Children's who's doing Monday session, and our facilitator from Good Sam who's doing Friday session.
Okay.
And one of them is more comfortable with the technology. The other one is still a little questioning, but as I've told her repeatedly, like, people will understand that this is the first time we're doing this, and we will learn from doing it. And that's, you know, we'll make sure that our participants understand that, and that their feedback is going to be really essential to us. So yeah, that's kind of where we are with it right now. We're feeling very hopeful about it. Yeah. I have, because I have the 3 different sites, I have a pretty comprehensive website about our Schwartz rounds. And just today I requested of our IT people, could I have one more page? Because I really need to have a page for virtual Schwartz rounds, because I need a place where I can tell people this is where you can go to know what it is, and also to see when they're upcoming.
That's awesome. That's fantastic. And of course they'll give that to you. Right?
Oh yeah, she's already given it to me, and it's blank right now. So I need to start putting content on it.
Oh, good. So, well, we won't keep you for too long, but you do such a beautiful job. Was there any resistance to going virtual? Because you do have such a well embedded program or series set of programs.
Honestly, I think people were just so thankful to see, like, Schwartz rounds, you know, that they thought, oh, good, you know, no, there was no resistance at all.
Yeah. Oh, that's fantastic. Well, I will say, no pressure, but for any of you, we welcome invitations to observe virtual Schwartz rounds, just because we are learning so much from every session that we do observe. So if you have a session, if any of you holds a session that you wouldn't mind one of our staff members joining, we welcome that opportunity. But again, no pressure whatsoever. We respect the confidentiality bit, of course. And barring that, we would love to hear from you all as you sort of venture into these waters about how it goes, and anything you'd recommend that we build into our guidance, because it's definitely evolving constantly. And I also just want to make a quick connection, just because Kim is on the line and Linda is on the line, and you both work in ethics. So I just want, should we ever have another conference, which we're going to do next year, we'll have to connect our ethics people, okay?
Okay, good. Yeah.
So with that, does anyone have any other questions? No, Beth, do you want to say anything else?
No, just thank you, and let us know how it's going, and we'd be happy to troubleshoot or, you know, just think out loud with you. So it's really helpful for us, actually, if you bring some of your questions, concerns, whatever, back to us so we can understand how it's going for all of you.
Yeah, absolutely. And with that, I'll just say thank you all for your time. Again, we're so sorry to get started late. I'll be posting the slides, the guidance, and the recording on the member website. If you have trouble finding it, just give a shout. Your member experience advisors will be reaching out, and we look forward to continuing this conversation. And we are so grateful for everything you all do. So thank you. Have a great afternoon and great weekend. Take care.
Thanks, guys. Take care. Bye-bye.
Bye.
Bye, thank you.